Thank you, everybody, for being here today. We've been doing employee forums for the last week and a half. And while I would love to be out in everybody's location with our schedules the way they are right now, as we prepare for our big move, it's kind of impossible. So I hope that you are in with your colleagues in conference rooms and eating pizza or some kind of good takeout while we go through our agenda today. And you can ask questions, and we'll be taking questions at the end. But what we really want to talk about today is why.
So just use first two pictures.
And a reminder that if
Darlene, you're going to have to unmute yourself because I muted everybody, including
Okay.
us.
All right. Okay. Can we go?
Yes, we can.
All right. Thank you, everybody, for being on the call today. And like I said, I would like to be out in everybody's offices, but it's just not going to happen because I don't have enough hours in my day. Unfortunately, it would be kind of fun. But we are glad you are all here. And what we want to talk about is our why we're doing what we're doing, the how we're doing it, the what of everything that we're doing, and what it means to you. We're going to talk about rumors, and we're going to talk about some upcoming events. And somebody can't hear you. Let's see. Maybe.
They should check their audio because I believe you are, I can hear you.
Can others hear me? Right.
I am seeing head nods, so it may be the system that they're on.
Okay, sorry. All right. So, Patty, can we go on?
Yes, go right ahead. Would you like me to click the
Oh,
slides?
am I driving it or are you? I thought you said you were.
I'm driving it. Are you ready for the
Yes.
slides? Move forward.
Okay. We need to practice this stuff before we impose it on our employees. I am sorry. Anyway, a reminder of our why. And I'm not going to read this mission statement to you, but I'm going to point out the words of why we are here working for the Mohawk Valley Health System and all of its parts, and why we are working in healthcare. And that is about our patients. So our mission statement, as you might recall, was updated a little over a year and a half ago, as we brought all of our organizations more together and started the process of building a single culture. And in an organization like we are, that has so many distractions, including our challenge with IT, it is really easy every day to forget about why we are here. So I ask that every morning or every afternoon when you come to work, that you review and think about what we learned in our high reliability lessons. And that is the STAR technique, to stop and think and remind yourself why you are in healthcare. And that's about our patients. It's not about parking. It's not about changes. It is about our patients. So when we updated our mission, we also updated our vision statement. And again, I won't read this to you, but our vision basically is an aspirational goal. What can we be? Not just what we are, what we have been, but what can we be? So I ask that people think about it and don't look at your shoes, but look up with hope and aspiration. And there are three parts to our vision. First, we want to be the leading healthcare provider in our region. We want to be the place people choose to go to. Secondly, we want to be the place where people want to work. We want to be a great employer. And third, and I know this will resonate with those of you who have grown up here, we want to be the pride of Central New York. We want you to be proud that you work here. We want your families to be proud that you work here. And we want your neighbors to be proud that we are the local healthcare system. Next slide. This is our strategic pyramid. And you can see on the top of it, and this, you might recall seeing this before, that the patient is at the top, and that is followed by our mission and our vision, and then our core beliefs. And our core beliefs are that the patient always comes first, that quality and safety are our top priorities, and that honesty, respect, and accountability for all are part of who we are. Now, over the last couple of years, as you might recall, we had an employee-based effort to really review and look at our value systems. And that process resulted in our employees recommending up, not senior leaders recommending down, but our employees recommending up what our values are. And those are accountability, kindness, teamwork, respect, and safety. And you will, I hope, notice that we are rolling these values out in many different ways and have employee-led efforts to try to bring those values more alive and to be part of everything that we do. The values sit on top of our strategies. And these are not new either, but I'll kind of review them with you. Instead of having a strategic plan, which is a finite plan that sits on a shelf, we have strategic directions, which are alive and sort of guide the work that we do every year. The first is that we will develop a unified aspirational culture. Secondly, is that we will meet the community needs of our population that we serve. Third is that we will invest in our people. Fourth, that we will chart our own destiny. And let me just say something about the charting our own destiny. Basically, what that means is that we want to be a stable, efficient, accredited organization so that we can make decisions about ourselves. If we lose sight of any of those, then it increases the likelihood that somebody else will make those decisions for us. And then finally, we're building our future. And what we're doing now is really to ensure that there's accessible, high quality healthcare available to this community for years in the future. Part of that is building a new healthcare system, the Wynn Hospital, of course. Part of it is our concerted effort to really reaching out into the communities we serve to make a difference on their healthcare. All of those sit on top of our strategic pillars, and those 5 pillars are how we organize our work at the leadership team. And those are also how the board judges how we're doing. They sit on top of the promises we've made to our stakeholders. And our stakeholders are our patients, our employees, the healthcare providers we work with in this community, as well as the community itself. And so I say this about it as a nonprofit healthcare provider, the Mohawk Valley Health System, the parent company, and all of its parts, which includes all of you, we are a nonprofit healthcare provider. That means we're not owned by the state, we're not owned by the county, we're not owned by the city of Utica, we are not owned by Steve Wynn. We are owned by the people that use us. We are beholden to them and accountable to them to do the right thing for them and to ensure that there is long-term health care for them in this community. That's our promise, okay? Now, under the strategic directions, if you will, you'll see that there's some writing in black followed by writing in red. So the black is things that we have worked on in the past, and the red are things that are more immediate. So under the unified aspirational culture, as you know, we have refreshed our mission, vision, our core beliefs. We've completed a rebrand. We've been engaged in cultural shaping activities. And now we're bringing the values alive and the guiding behaviors to all of our employees. And I think you all should have seen those by now. And we're engaging all staff to orientate to the Wynn Hospital. And I'll say this about the Wynn. I know that not everybody is going to work at the Wynn. And if you're not, you can feel a little left out of all of the focus and the hoopla and the attention that the Wynn is getting. And we get that, we understand that, and we are sorry that that's how it feels. But We have to do that because we have one opportunity to get it right. One opportunity to get this right. And for those of you that have lived in this community for a long time, you'll understand this when I say, if we get it wrong, people will still be talking about it for 35 years. And so we are hyper-focused on getting it right when we move into the Wynn, because that will have an umbrella impact on all the parts of our organization. So we are going to be engaging all staff in orientation to the Wynn. We are starting with those that will work in the building and get them done first, because we have over 4,000 employees. There's a lot of orientation to do, but we will also make opportunities for all the rest of you to become familiar with the Wynn as well. When we come to meeting community needs, our product lines really reflect the disease, if you will, incidents of the communities we serve. So that is cardiac, women's health, stroke. We are the third largest stroke center in the state of New York. Cancer, high cancer incidence rate, and surgery. Those are the areas where we provide the most services. That's what our community needs from us. And that is where we invest in equipment and personnel. In the second, investing in our people. What's red down there is that we will be rolling out customer service training or service excellence, whatever you want to call it, to all of our employees. We're going to start that first with the patient-facing people at the Wynn Hospital, so that we get them done first, so that when our patients come into that new facility, they are met with that customer service training that we will then make available to all of our organization. We expect that might take until about Thanksgiving, but we'll roll that out to all of our outpatient facilities as well. I don't think we have done that here in many years, and it's important that we all approach the service excellence training, if you will, or service excellence delivery in the same way. We use the same words, we react the same, we have the same values, and that helps build a strong brand. That helps go back to the mission and vision statements, where we're going to keep the patient at the top of what we do. It is our goal that we build that pride in our organization. In charting our own destiny, as you all know, we have rolled out several years ago high reliability, and 96% of our employees have been through that training. And now every new employee, that it is part of their orientation. And you can hear that it's working because the words that we're using are the same, and the way we are going after identifying issues has really, really improved. And all of that is great. But we are now taking those same concepts and applying it to our organizational operations to increase our accountability, our efficiency, and to have consistent performance. Consistent performance. So that's easy to say, a little harder to do. Let's talk about on-time starts. We want to be known as an organization that does on-time starts. Well, that takes a whole operation to be functioning like a well-timed clock, well-tuned clock, to make that happen. And it also requires that we hold people accountable for being on time themselves, so that we don't inconvenience our patients and delay their care. And then finally, building our future is twofold, maybe threefold, but first, we want to have that successful move into the Wynn, because that gives us the opportunity to wow and do a reset button and really impress people with what we have done here and are doing. Secondly, we're going to continue to build out downtown campus in terms of healthcare delivery. And third, importantly, is expanding the medical education and the residency programs. And those are so important to not only raising the bar of what we do, they allow us the opportunity to recruit from those residents, which goes back to investing in our value that we want to chart our own course. So all of those fit together. So these are some of the things that are happening as we prepare to move into the Wynn. There are some changes in nursing structure and leadership. Jerome Deo, who is our CNO, when he got here, and Jerome has been a great CNO for us, he pointed out the obvious, that our delivery of care from primarily nursing is 24/7, but that we staff our organization like we're 9 to 5. And point well made. So Jerome is elongating, if you will, the nurse leadership coverage. So we will be here from I think it's 7 to 11, something like that, that there will be a nurse leader in charge. Now, that does impact a few people's jobs. But if you go back to the top of our pyramid and why we're here, it is about the delivery of patient care. Also, just if you haven't seen it, in the Wynn, we are doing away with those long, units, patient units with nurse desks on both ends or directly in the middle. And we are having team stations. So there will be small team stations for every 4 patient rooms. And supplies, etc., will be located right there by that team station. Again, this is to reach our goal of keeping the patient first, but also it's a safety issue, having the patient taken care of by people that are right there adjacent to them. It does require, just think about how much everybody's jobs are changing. It does require different models of interacting on the nursing units, but it also has a huge impact on our supply distribution network, because we're going from about 80 different supply locations to over 220. So supplies will be close to every team station, convenient for the staff. When moving into the Wynn, we are starting now training the trainer, and they will provide orientation to everybody that's in the Wynn. Anybody that is going to be working in the Wynn will be required to have orientation to the building, life safety codes, technology, of course, but to their own department as well. We talked about high reliability processes and the service excellence. The parking garage will not be open by the time we move into the Wynn on October 29th. So we will be providing valet parking for the patients, their families, and our guests. We also, in the lobby, will be embedding translators and turning it into more of a guest relations than, check you in and out. We'll still have our security processes, but meant to be more of an engaging, welcoming environment. We have about 40 patients a day in our hospital beds that don't speak English or don't speak English well. So we will have those translators, cultural ambassadors in the lobby to help with their processes and make them feel more welcome as they come in. We also are in the process of negotiating uniforms for all of our staff. We are starting with the hospital staff first. The goal is to have consistent colors of uniforms based on jobs. All RNs will wear the same colors. All rehab therapists will have the same colors. All EVS, security, housekeeping, et cetera, will have the same colors, so people don't have to guess who you are. Again, it is a safety issue. However, it is also really important to improving the professional way that we appear to our patients, their families, and our guests. So we also talked about high reliability. There's much going on in that journey. And we're working with a company called HCR. This is healthcare relocation for our move. This is the way we move our patients on one day is getting a lot of attention. And this is how I say it. We are doing this because we have hired the experts to help us figure it out. HCR has moved more than 500 hospitals. And the largest they have moved was in Stockholm, Sweden, where they moved 1,400 patients in one day. We think they can move us. They have a real system to how they do this that's tried and true. They've been doing this for many years. On the day of the move, I think this speaks to who they are. On the day of the move, there is an organizational structure that is not like we have today. And that org structure is about clinical decision-making to get patients to the places they need to go. So there are about 8 to 10 leader roles in that org structure, and each of them have X number of employees that will work for them. And all of them that day take their direction from HCR. And they will be handling the move. I think we all have great faith in them. They've been doing this for a long time. And that certainly, for me, takes a lot of the stress out of it because they know what they're doing. And parking, because the parking garage won't be open when we move into the Wynn, we are going to be short about 300 parking spaces for our employees. We will have surface parking. The county is working with us to supply some parking, but we will bus probably from St. Luke's about 300 employees every day. We are working with a company to do that busing for us, or shuttle for us, that does the shuttle on a daily basis to Crouse, SUNY, Bassett, and the hospitals in Albany. All of them permanently bus staff from offsite locations. So they know what they're doing and they will help us with this process. So we also feel that they are the right experts to help us get this right. We are getting a lot of questions about that. We do not have people's assignments yet for where they'll park, but we are keeping everyone's questions and we'll have that available to everybody. Because I know some of you on this call, you might come in and out of the hospital. There will be designated places for you to park. Okay. Okay, so what this means for you, if you are going to be in the Wynn, you have to do your training. We also ask that you do your mandatories on net learning. Everyone should make sure that their mandatories are updated, please. We also suggest that you refresh your HRO skills. We recently had the company review how we were doing on our HRO processes, and there are several things that we do really well. The consistency of our 8:15 daily safety huddle. We have never waived off that. And that is, they've considered that best practice and how that call is made and what happens on it. Second are the huddles that happen on our nursing units, our best practice. And the third are the handoffs at the bedside. Where we fail as an organization, we have forgotten to wash our hands. Now, if you think about COVID, we all were obsessed over washing our hands many, many times a day, but apparently we've forgotten. And you will be seeing a lot about that, whether you're in the practices, in the outpatient center, or in the hospital, or in an office. We have to remember to wash our hands. We ask that when your time comes, you also sign up and participate in the service excellence training. Everyone should have received about a week and a half ago a parking survey. We need to know the make and model of your car and your license plate, because we are going to be enforcing our parking assignments. And if you are coming if you don't park downtown, but you're coming down for a meeting or something, we need to know who you are so you don't get a parking ticket. So it's important that we have that information for all of our employees, no matter where you're parking. We also are celebrating. This is, who gets to open a new hospital, right? I mean, this is really big. So we will be having some events on the 9th of September, which is a Saturday. We are having what we would call an employee fest. And we are asking everybody to start that day, which I think will be about 10 o'clock in the morning, at your hospital of choice, St. E's, St. Luke's, or Faxton. And if you don't have one that you consider your home, we ask that you go to Faxton. And the city is going to close down Genesee Street. And I think we have 1,000 people already signed up. We will be walking down Genesee Street together to the Wynn Hospital, where we'll have a festival. There'll be food trucks, music, games for kids. So we really encourage you to bring your family. But a day of festivities, there'll be drawings and fun stuff. We'll also make tours of the building available to you and your families. So I think it's really important for your families to get to see the Wynn before it opens to our patients, because then tours will pretty much be non-existent, and they should see what's happening in our community and see the place that is part of your work as well. So please plan on signing up for that and joining us. And then on the 15th, which is a Sunday, we'll be having the ceremonial ribbon cutting. We expect the governor's office, the governor to be there. We expect Schumer to be there, Steve Wynn to be there. We're not going to have lots of long speeches because nobody likes that. But we'll be having live music, food, tours, and other events. So we hope you'll be part of that, because this is, again, a once-in-a-lifetime opportunity. Additionally, we recognize that not everybody is familiar with downtown Utica. And we have walking tours and maps available for people in different ways, where you can get together with a group of your coworkers and grab a map and take a walking tour. You can go to restaurants, bars, look at historic buildings, but it's a great way for you to see the downtown. And I'll tell you, the downtown merchants are very, very happy that the Mohawk Valley Health System employees are coming into their organization. So you'll be very welcomed by them. So what else is happening? We have a new Chief Information Officer, Tammy Canfield, started with us last week. Tammy has a great resume with lots of epic experience, and we are really happy to have her join us. She is a classic story of somebody who grew up in central New York, who went away to school, went away to build a career, and now wants to come back and to do something important in the community where she was, in the part of the state where she was raised. So we're very happy she's here. We also have a new orthopedic surgeon that started on Monday. We have a second robot now, and that is up and operating at SEMC. We are moving our two women's groups from Women's Health Services into Faxton together. That progress is underway, and that will happen at the end of September, early October. We continue to do very aggressive recruitment. And I'll say this Monday, there were a lot of people that identified one of our physician practices as their employee location. So I always go around the room and ask people where they're going to work. So a big week for our practices, but we're having 40, 50, as many as 60 people come to our bi-monthly orientations, which is great. So next 2 years, we will continue to work on the cultural development of the Mohawk Valley Health System and all of its part. That is not something you do in 6 months. That goes on for years. But to really strengthen our culture, which strengthens our brand. But we have the more visible parts that I know your neighbors and families see, is the construction part. And the phase one, that is the Wynn Hospital, and getting that done and moved in there well. Phase two is to complete the medical campus. And that's about the transition of the Utica National Building, which will become home to the offices for our physician, the medical practices, the residency practices. The parking garage will open the first part of March. The central utility plant, which is the old Mohawk Hospital Supply, it's the long white building across the street from the hospital. That's where all of our central utilities are. Purchasing supplies will be there. IT is in there. We'll be putting some sleep rooms in there. Pathology will eventually be moving there. That's going in that location. And then there is the MOB, which is being built by Central New York Cardiology, and we are their largest tenant. We will have outpatient services there. Our employee pharmacy will be there, and importantly, we will also be opening an ambulatory surgery center there. Then phase 3, that's everything else. So I'll state the obvious. When St. E's and St. Luke's came together, we didn't necessarily make decisions about everything that we brought to the party. We had a lot of different businesses, locations, practices. So it is our goal that after phase 2, that we go through and purposely make decisions about the broader footprint. Are we in the communities we should be in? Do we have the right level of services in those communities? What do we need to invest in? What do we not need? And make those conscious decisions. And then we'll make some other decisions like, you know, what we're going to do with the old Burstone house, which is where the board meetings are, what we're going to do with the old HR building, because HR is expected to move downtown into the Utica National Building, things like that. But that's phase 3. In the meantime, we still have some special projects we're working on. I talked about the OB moving into Faxton. We also are going to be merging the 2 infusion centers at Faxton together. We have made the decision that Faxton is going to be an important part of the future of our organization. And while there is a lot of empty space in the building now, it's almost all spoken for. So we have several projects that will be happening over the course of time, and that building will be filled. We also are going to be relocating Sister Rose Vincent Family Medical Center. If there are any of you on this call from Sister Rose, you know that I'm speaking the truth when I say that is a substandard location for our patients and our employees. The building has terrible HVAC and it leaks, and it is not the standard to which we should aspire. So we have been looking around and identifying potential locations. We think we have found a priority location for Sister Rose. Are negotiating that now, but we'll expect that that whole project will take a couple of years, but that we will have better space, modern space for our patients and our employees. Okay, this is where we talk about our rumors, which are always fun. Rumor number 1, the move won't happen on October 29th. Yes, it will happen on October 29th. We are feeling very good about the progress that we're making. So there's no reason to indicate we won't move in on the 29th. And by the way, we're being moved in by a company called HCR. That's when they're coming to move us. So we've got to be ready. The new hospital won't be big enough. So we're building a 373-bed hospital. We have an average daily census now of about 220 or 325. So we are building with additional space. If there were another pandemic where we bumped up like we did in December of 2020 and January 2021, which was a terrible time, we have 2 outpatient areas that we could immediately turn into inpatient beds on a temporary basis. However, we don't believe that that will be necessary for the long term. If it is, we could just pick up administration and move it to a conference center somewhere and build clinical space in that soft space. And plus the end of the building over the ER, that is also designed for expansion if needed. Everyone will have to reapply for their jobs, and no. We have been fighting that rumor for 4.5 years. And I will say in the previous organizations I worked in, that was also the rumor. That does not happen. That is unnecessary. That is not going to happen. The building has sunk. No, the building has not sunk. In fact, some people are so, I don't know how they think they know this. maybe they're out measuring it, but they think the building has sunk 1.5 inches. They're very specific about that rumor. Don't know who makes this stuff up, but a former board member from a hospital in Buffalo told me that they had heard that same rumor when they were building a facility many years ago, and how funny it was, followed by the next rumor that that we have mold. And that's the same rumor they had. Now, the only thing that is similar to us is that we have a lot of contractors from Buffalo working on this facility. No, where do these rumors start? Just saying. We have a company that every week goes through and looks for issues specifically for mold. They don't work for or with the other contractors. They're an independent company to ensure that if there is an issue, we find it post haste. So we feel very positive about that. And then our favorite rumor is that it's not really a hospital, that the Wynn is simply going to open as a casino. That this is my favorite. So first, we talked about the fact that, I think we did, that we are a nonprofit hospital. And as a nonprofit, we are beholden to our community. We can't just change the fate of a hospital. Well, we don't have that power or that right. And also, if you were going to build a casino, you wouldn't go to the expense of building hospital grade space. So it might be easier to run a casino. There's certainly more money in it than healthcare, but no, we are a hospital and we are going to stay a hospital. Other rumors that we've heard from our employees over the last few days while we've been doing these forums. First, that we will have skeleton crews left at both hospitals. No, that's not true. We will not have skeleton crews at either hospital. So let me just say this specifically, and I think we've talked about this before, but on the St. E's campus, the School of Nursing at this time is not slated to move. Miriam Medical, which is where the cardiology group has their practice, they will move out when the medical office building is done, and that property is for sale. At the St. Luke's campus, we are maintaining our long-term care facility on this campus that will stay here. St. Luke's Hospital will close. Attached to the one end of St. Luke's is a medical office building. That's the entrance. That's for Safe Path, if you know where that entrance is. That building will be walled off, if you will, from the rest of the hospital, because we will leave some physician offices and the pathology department in that building, as well as the employee pharmacy in that building until their space is ready downtown. Some of our physicians will be moving into space in the new medical office building. The employee pharmacy will be going into the new medical office building downtown, and pathology will be moving into the Mohawk Hospital Supply building, but it'll be several months before those change. We will have full-time security, though, on both campuses. We will have full-time security on both campuses. I'm trying to think of what other thing about those rumors. Okay, I think that's all the rumors. There was a major plumbing issue, leak in the OR. Yes, there was a broken pipe that leaked into the ORs that required the floors to be, some of the flooring to be ripped out and replaced. That is true. That happened, I don't know, 6 weeks, 2 months ago, I think. I can't really remember when. Yes, it was an expensive issue. It was not our issue, and we don't have to pay for it. But there was a leak from a broken pipe. Patty, other rumors that we were going over today.
Let me look. We also had the
While you think about it, when we close the two hospitals, there will be ambulances and police cars assigned to sit in front of the ERs for, we don't know if it's going to be 1 week or 2 weeks. We'll also put up Jersey barriers. So as much as possible, we've got to make those places look closed. But it takes people a while to remember, right? So we will have ambulances and police cars there to redirect traffic in the short term. Signage, highway signage will be the work of the Department of Transportation. We've been working with them on designing signage to direct people to the Wynn. The day of the move, the old signs will be covered. They won't be taken down that day because it's a Sunday, but they will be covered up and traffic redirected.
The two other rumors we heard is that MVHS is buying Kennedy Plaza Apartments,
Oh, that's right.
and the other is that Ascension is buying MVHS.
Okay, so no, we are not buying the Kennedy Plaza. That's the tall apartment building near the downtown hospital. No, we are not buying that. And Ascension is buying us. Ascension, I think, is a Catholic healthcare system. But the other one we also hear frequently is that Trinity is buying us. Neither of them are true. Neither of them are true. That goes back to our strategic priorities. If you remember from our org chart that we've been working on for 4.5 years, we are going to be the owners of our own destiny. We are the owners of our own destiny, and we are not turning our keys over to somebody else. And I heard that everyone will have to wear matching scrubs. That's true. Yes, we will. We're going to start in the hospital with uniforms, matching scrubs for the jobs that you have. So all our RNs will be wearing the same color. We'll be rolling that out also to the physician practices and to our outpatient centers. There are color palettes that have been developed that I would say match. I sound sort of like, I know it's not cool to be too matchy, right? But have a color palette that looks like all of the uniforms belong in the organization. So that will be rolled out to everybody. We will be buying the first couple of uniforms for everyone. We're talking to our vendors now to make sure that they have uniforms in the colors for people. We won't be dictating style. We will be dictating dress code, though. We will be dictating dress code. And what does that mean? Well, if you can go from your office to the beach without changing clothes, you are not dressed appropriately for work. Any truth that Utica University would be using part of St. Luke's campus as their dorm? No. Utica University used to use part of the Burstone building, which is up on Burstone Avenue. That's where we have our boardroom. It's an old hotel. They used to use that for their dorm, but they stopped using that pre-COVID, and they built additional dormitories on their own campus, and they don't need any additional dorm space from us. We are now using that same space as housing for the med students that are in town. But Utica University is not interested in any part of St. Luke's. They have a lot of expansion space on their own campus. And we talk to them friendly. We have a great relationship with them, but they're not interested. Okay, I saw another question come up.
The question is, can you send out a follow-up email explaining the breakdown of building reassignments and locations of different facilities and what Utica National will be used for?
Sure. So all of those questions are not completely answered. We do know that Utica National, the two priorities to go in there will be the office space for the medical residency program. Nothing clinical can go in that building. That is our agreement with the building owners. We have a long-term lease. And HR, human resources, will be moving into that building. We don't know at this time what else might be going in there. And on the Mohawk Hospital Supply, which is a central utility plant, we do know that in that facility, we will have supplies, materials management, will be storing there and have offices there. We will have some sleep rooms in that space. We will have pathology. Some of the IT offices are in that space. And there is additional space now, which we have not figured out everything else that'll be going in there. And when we finalize things on Faxton a little more clearly, we will roll that out to everybody as well. But with Faxton, because of the HVAC system, if you do one project, then you got to do another project. So it gets pretty complicated, but it is our goal to fill that building up. Other questions? The apartment building is getting an exterior makeover for the opening of the new Wynn. Do you mean the Kennedy apartment building?
Huh.
Yes. I haven't heard that. I kind of doubt that. That is owned by the housing authority. So therefore, you know, quasi-governmental housing and city housing, and have not heard that rumor, and that is up to theirs. Yep. What will the St. E's buildings be used for? We don't know what St. E's is going to be used for. So both St. E's and St. Luke's will be for sale. We're working with the city of Utica and the IDA, the county of Oneida, and the IDA for St. Luke's. So St. E's with the county, with the city, St. Luke's with the county, to do RFPs to look to find a company that can come in and say, this is what these buildings should be used for. We're doing them separately because they're very different locations and very different pieces of property. But if you think about this community, there are not a lot of good spaces that are large like that can accommodate major building. So I think I am very positive. It'll take some time, but that both of these hospitals' bases will be turned into something else.
There was an additional question asking for clarity on what you mean about sleep rooms in the central utility plant.
Yes, but so there are more people that want to apparently stay overnight than we have built rooms in the Wynn for. So we're going to be adding some additional sleep rooms across the street in that building.
But that does not mean the sleep center, correct?
No, it doesn't mean sleep center. No, the sleep center right now is staying where it is. Sorry. Yes, these are our sleep rooms for, you know, residents that are maybe on call, other people that are on call. When the Wynn was designed, remember, this was a lot of years ago that the hospital was designed, and we did not have the residency program like we have now, which adds additional need for sleep rooms.
There's another question asking for explanation more about uniforms for off-sites, both clinical and non-clinical.
Okay, we don't know what color everybody will be wearing, and we don't know exactly when it'll be rolled out, but it is our intent that if you are, you know, a CNA, you will wear the same color as other CNAs. We don't know how far that'll go. The question was asked last week, are we going to require people at the desk as they're checking people in to wear uniforms? And some of those discussions we have not followed up, but the intent is that people in like jobs will wear like colors in all of our facilities. It'll take some while for that to be rolled out to everybody, but that is our intent. One of our employees last week, while we were having forums, suggested that we could maybe do even some employee swaps. If the colors are right, we could swap some clothes, or we could make them available to other non-MVHS organizations for people that might need some additional uniforms. And I have 18 chats here, Patty, but I can't see any of them.
The only other question or comment was that St. Elizabeth's may be useful for dorms for the nursing college.
Yeah, that space is too big to separate it out for nursing. Miriam Medical would almost be easier because that's closer. But that would not be conducive for St. E's. And we believe that St. E's, which would include Miriam Medical, the parking garage, where the central utility guys work, as well as the former Sisters building in the back, that all of that together is a pretty good sized property and will be very attractive to somebody with an idea. And that idea might be housing. I'm just saying, that would be a good use of the St. E's space.
I'm not seeing any other questions at this time.
Okay. We'll give everyone a few seconds.
Where are people being bused from, St. Luke's or St. Elizabeth's?
We don't know yet exactly, but we think it'll probably be St. Luke's. Yeah. Again, we're working with a company that will be doing that busing for us that has more experience than we do. It is not our intent that it'll continue forever, but we'll have to do it until our parking garage is open at the beginning of March of 2024. So I would say it's likely to be St. Luke's, but we don't know that for certain yet. Do you have any concerns about the recent negative publicity? Already, Mr. Wynn. Do I have any negative, it says if people can see it, any concerns about the recent negative publicity on Steve Wynn? No, I don't. It's not helpful. It's not great, let's say, but those are long-term ago allegations. And we don't respond. We just roll with it and it disappears pretty quickly. Those allegations, those stories, that reputation has been around since way before we met Steve Wynn. Closure of any of the outpatient primary care sites in phase 2. I don't think so. If we're going to close any outpatient primary sites, but I also will say honestly, we've never really looked deeply at it. So the way you would do this kind of planning is to look at a footprint of where you want to be, ask the question, are we in the right spots? Should we have expansion places? And then what's the process for doing that? So I'll never say never. I don't know, but nothing comes to mind where I would say, yeah, we got to get rid of that.
We have 5 minutes left, so if anyone has a question, please put it into the chat box.
Yeah, and while you think about that, I will tell you that I continue to get wonderful responses from patients about our inpatient services, our outpatient services, our physicians, our nurses, how they get cared for by people. It really, I call them my love letters. It's really great. I get love letters every week from patients. We share many of them with you. We don't have enough space to share all of them with you, but clearly we have a workforce that cares deeply about the people they're taking care of. What about collared wind shirts for front desk office staff? Patty K, is the front desk office staff part of the dress code recommendations?
At this time, everybody is subject to our dress code policy.
Oh.
There has not been specific discussion about Wynn shirts for front desk office staff. We do expect professional attire, so staff are welcome to take a look. We have updated the dress code policy. I'm not sure if it is published yet on the intranet, but it will be.
Yeah, I'll just say one thing about dress code. I tackled this issue many years ago at one of my organizations, and we started with nursing, who went kicking and screaming. They were very, very vocal about it, but we did negotiate it with the unions. And within 2 weeks, other departments were coming forward because they had such positive reaction to the nurses. The public had such positive reaction to the nurses. The nurses were very proud of how they looked and appeared and how people treated them. It was very positive that other departments came forward. And we then took them one department at a time. Eventually, we went as far as the financial counselors and the people that they would check in with registration desks. I don't know how far we'll go. We're going to start with the obvious clinical staff first here. Anything else?
Is there
Yep.
any plan to expand CCON nursing school enrollment?
We would love to increase the nursing school enrollment. The biggest challenge for that is finding faculty. There are very stringent requirements about the number of faculty per students. We have worked with other universities and colleges to engage them. They are all saying the same thing. The requirements are so stringent, dictated by state levels, and really, really hard to find staff. But if there came a time when we've had a lot more staff, we would certainly be able to expand our nursing school. That would be great.
We have 1 minute left.
So again, thank you, everybody. As you know, you can always reach out, ask me a question online. We're so grateful for the good work that you're doing, the progress that we're making as an organization. Change is hard. Change is difficult for people. And we know there's a lot of change going on. But again, if you just keep your focus on the top of our pyramid and why we're here, we're doing it for the patients. We're doing this for the patients. So thank you for being along on this ride with us.